Royal Caribbean just announced some big changes in order to keep everyone safe on a cruise ship. And basically, everything we knew about planning a cruise vacation is out the window. I've got all the info announced up next. Hey everyone, it's Matt from RoyalCaribbeanBlog.com, and Royal Caribbean Group and Norwegian Cruise Line Holdings announced its healthy sail panel recommendations for cruises to restart. Now, this can be a really super confusing time if you're planning a cruise in late 2020 or 2021, so I'm going to break down what I know so far to help tackle the biggest questions. And there's a lot in this because Royal Caribbean released 74 steps that it believes are necessary to keep cruise ships safe from the spread of COVID-19. Now, the list of protocols is 65 pages long. Yikes! Yeah, but I'm here to break down the most important changes. So let's start off with number one. Not all of these changes you're about to read about or hear about, I guess in this case, are permanent. You should be aware that some of these changes are only meant for a temporary period in the beginning when cruises resume, and the panel indicated that a lot of these can be modified or removed later. Each recommendation falls into one of two categories: one that can be scaled down, modified, or discontinued over time, or one that really should be implemented for the foreseeable future. Now, the panel said it was not able to determine specific parameters as to when that might occur, but it does recognize that certainly a lot of these changes and policy recommendations are based on what's happening today, and months from now, a lot of that could change. So let's get things off with number one: you will be tested before and during your cruise. The Healthy Sail panel said that while a vaccine may change things down the line, in the interim, testing is going to be a big part of the experience to make everybody safe. Before the cruise, everybody going on a cruise will need to be tested 24 hours or up to 5 days before your cruise, so you're able to receive a negative result prior to even beginning your trip to the cruise. So if rapid and reliable tests become widely available, the cruise line should administer a second test at the pier or immediately before boarding to improve confidence everybody on board is healthy. But at the very least, you should expect to have to take on your own a test anywhere between 5 days and 24 hours before your cruise to make sure that you have a negative test. When you get to the embarkation port, there will be another opportunity to do temperature screenings, and once on board, the panel recommends that temperature checks be conducted every day, and preferably in the later part of the day when individuals are more likely to present a fever with 100.4 degrees Fahrenheit or higher. The panel does not recommend that the cruise lines perform temperature checks more frequently than once a day. Next up, you will be denied boarding if anyone in your group tests positive. I'm going to make this nice and simple. If you or anybody in your traveling group tests positive for COVID at any point during the trip or even before the trip, you will all be denied boarding on board the cruise. Preventing infected people from boarding a cruise ship in the first place is a primary focus of keeping cruise ships safe. And in addition to the health screenings conducted at embarkation, there are some automatic denials for everyone in a group that may have been tested positive recently. Next up, guests and crews should wear masks. Man, one of the biggest questions since the pandemic began is when cruises resume, will we have to wear a mask on a cruise? And the answer is yes. The Healthy Sail panel says guests should wear face coverings in any indoor congregate setting, regardless of physical distancing measures, but should not be required to wear face masks in their own cabins. A notable exception is indoor dining. Seating in restaurants and bars or lounges should allow for physical distancing, so guests can eat and drink without needing face coverings while seated. Face coverings are not required in outdoor settings as long as physical distancing is feasible. However, if physical distancing is not feasible in certain outdoor settings, masks and face coverings among guests should be required in those locations. The next big change that Royal Caribbean will be making is cruise ships are going to have reduced capacity. Initially, Royal Caribbean should not sail with the ships full in order to facilitate physical distancing, especially as procedures are being tested to ensure they're working properly. Capacity can be gradually increased as conditions permit. Now, capacity reductions should also be applied to all ships in terminal venues like restaurants, retail, casinos, lounges, fitness centers, as well as transportation vehicles and shore excursions to allow for appropriate distancing practices. And no, they didn't say exactly how less people should be on the ship, nor how they'll determine what happens if a ship is already booked above a certain threshold. That's going to be one of the other questions that we're going to have to wait and see from Royal Caribbean. The next big change is spreading guests out. The specifics of exactly how cruise ships will be physically distanced will depend on the ship, but the panel did provide some examples of social distancing that it recommends, such as spacing out loungers at the pool, separating tables at restaurants or leaving some empty, blocking off certain seats in the theaters, blocking off some slot machines to allow space between guests, moving activities outdoors where possible, like holding yoga class on the ship deck rather than in the gym. The Healthy Sail Panel believes the removal of and substitution for self-service buffets during this time will help to maintain these general distancing guidelines and avoid overcrowding, and should therefore be implemented across all ships. But of course, the other big question is what happens if there is a COVID-19 case on the ship? And that's a big part of a lot of these protocols, is how to contain and control that. And it really comes down to two basic things: containment and evacuation. Off the bat, the panel recommends that certain staterooms should be designated as isolation and quarantine spaces. These spaces are for people who have either been exposed to someone with a confirmed infection and or individual who has tested positive. Now, individuals who have tested positive and who are experiencing symptoms consistent with an infection will be isolated in a designated isolation cabin within close proximity to the medical ward. People that have been exposed to somebody who had a confirmed case will be quarantined in a single occupancy cabin with a private bathroom, unless, of course, they're quarantining with family members or close contacts with the same exposure history. No interconnection with an adjoining room, door closed, and preferably with a balcony. Now, in the event that a case is identified on board, Royal Caribbean is working on a plan of action for getting these people off the ship and to a land-based facility. There should be plans in place for small, medium, and large-scale evacuation scenarios to avoid really what happened with some of those cruise ships early part of 2020. There's a lot of guidance on this subject in the plan, but the bottom line is they're going to have to come up with a plan of action for getting people off the ship should any kind of case exist. Another big change is only cruise line shore excursions will be permitted in the beginning. This is not much of a surprise because other cruise lines in Europe have already done this, but like other cruise lines have implemented in Europe, the recommendation is, at least for the first few cruises back, that guests should only be permitted to get off the ship at any port if they're taking cruise line sponsored excursions. The panel does recommend that Royal Caribbean actually, and this is a quote here, potentially reconsider the cost of curated experiences, end quote, to make these more appealing. But in addition, if there's an indoor excursion that should be offered, it should only be offered if physical distancing, the use of masks, and other recommended protective measures can be implemented. So at least in the beginning, you should expect to only be going on Royal Caribbean shore excursions that are available through the cruise line, and it doesn't sound like we'll be doing much, if anything, on our own for at least a little bit while cruise ships are in port. And the last big thing, and this is something that I think is even arguably the most important part of this whole step, is how actually cruises should restart. The panel came up with a pretty good plan of how it thinks Royal Caribbean should restart cruises. There's a couple steps. The first step should be a simulated cruise. Basically, they take a Royal Caribbean ship, dock it somewhere, they have employees, Royal Caribbean employees, come on board, pretend to be guests, and the ship never leaves, but they have an opportunity to test out the core initiatives that we're talking about here. Following a success of that, there should be a short overnight cruise with limited load factor that would once again be conducted with employees pretending to be guests with more activities offered on board. Now, if all that goes well, then Royal Caribbean should do one more test by offering a short cruise to a private destination like Perfect Day Coco Cay. The initial cruises with paying customers should be as simple as possible, with limited destinations, controlled excursions, and short trip lengths. Once these initial sailings are conducted and internally examined, it may be appropriate to carefully expand operations. Wow, yeah, that's a lot of stuff there. And if you want to read the results of yourself and see all the recommendations, there's a lot of it. I'll have a link below this video for you to check on out the new Healthy Sail Panel recommendations. Again, there is a lot to go through. A lot of these changes are here. And remember, some of these changes, in fact, a lot of these changes are really meant for the short interim. And obviously, as treatments and vaccines and prevention policies are added and things evolve, a lot of what you're reading here may actually end up changing quite a bit over the next couple of months. So keep that in mind if this sounds scary to you, if this sounds a little too much. This is not permanent. But I want to hear from you all along those lines. What do you think about these policies? And most importantly, given everything I just mentioned here, would you still want to go on a Royal Caribbean cruise? Which policies do you think make sense? Is there anything here that really stands out that is significantly different from what you've experienced in your day-to-day life at home? Share it in our comments below. I would love to have you weigh in with your thoughts. And while you're down there, be sure to subscribe to our channel, give this video a like, and turn on your notifications so that way YouTube lets you know when I have a brand new video to share. This has been Matt from RoyalCaribbeanBlog.com, and we'll talk again real soon.